Hello, everyone. Bon vendredi, tout le monde.
Hello, everyone.
I'd like to begin by addressing what unfolded in Washington, D.C. this week. What we witnessed was an assault on democracy by violent rioters, incited by the current president and other politicians. As shocking, deeply disturbing, and frankly, saddening as that event remains, we've also seen this week that democracy is resilient in America, our closest ally and neighbor. Violence has no place in our societies, and extremists will not succeed in overruling the will of the people. As Canadians, I think we've been all reflecting on our own country, something I spoke with the premiers about last night, about the fact that democracy is not automatic. It takes work every day. About what a real accomplishment it is to maintain a political system in which the losing side gracefully concedes and in which rival political parties between elections work together for the common good. We have this in Canada because Canadians make it possible. Canadians expect their political leaders to protect our precious democracy by how we conduct ourselves. We have seen this manifest in unanimous consent in our Parliament for our main COVID-fighting measures at a time when the government holds a minority of seats. We see it in the cooperation between the federal government and provincial and territorial governments, regardless of political stripe. Canadians expect debate. Debate in service of all Canadians. Debate that is grounded in a shared acceptance of the facts. In a diverse country, there will always be diverse perspectives, and it is through respect for those differences that we create a stronger Canada. Canadian democracy didn't happen by accident, and it won't continue without work. We must always work to secure our democracy and not give comfort to those who promote things that are not true or give space for hatred or extremism.
Yesterday, during our 24th meeting of the ministers of the provinces and territories, we talked about what happened in the U.S. this week. We were all shocked to see extremists incited by the president to act with such violence in the capital of Washington. It reminded us that we cannot take our democracy for granted. Canada's democracy didn't happen by chance, and it will take effort to continue. Canadians expect honest debate that serves all Canadians. Debates, we all have to have a shared acceptance of facts. We all have to protect our democracy and promote democracy and avoid the space that is allowed for hatred and extremism. We also discussed long-term care homes with premiers, measures for travelers, testing and vaccines. Our government is working on vaccines tirelessly. We have been doing so for months. The distribution process has involved doses, particularly for Pfizer's vaccine, is a complex challenge. But thanks to everyone's efforts, we started distributing doses earlier than expected as of December 21st. We're doing everything we can to obtain as much vaccines as possible and as quickly as possible. Major General Fortin will provide detailed figures today. In December, we distributed roughly 500,000 of doses of this vaccine across the country and to more than a large number of doses in Quebec. In January, there will be 1.4 million doses of Pfizer's and Moderna's vaccines that will be distributed in Quebec. And we're trying to do so as quickly as possible. People are dying. Hospitals are overflowing. And we don't want to see this. This is a crisis, and Canadians want results. I understand, and I promise that we will work tirelessly. We're continuing to cooperate with all levels of government we have a large team. More than ever, it's the time to gather our forces to fight COVID-19 once and for all.
Yesterday, at our 24th First Ministers' meeting, the Premiers and I discussed the vaccine rollout across the country. We agreed that it is vital that we work together as Team Canada to get vaccines delivered, distributed, and administered as quickly and efficiently as possible. The Premiers and I also discussed ways to combat misinformation. Vaccines are safe and effective, and everyone should be doing their part by getting vaccinated once it's their turn. This week, over 124,000 doses of the Pfizer vaccine were delivered to 68 sites across the country. Over 208 Pfizer doses will be delivered weekly for the rest of January. On Moderna, by the end of next week, over 171,000 doses will be delivered to the provinces and territories. We're on track to deliver approximately 1.3 million doses of the Pfizer and Moderna vaccines by the end of January. Quantities of both the Pfizer and the Moderna vaccine will scale up in February. Remember that Canada has the most vaccines secured per capita in the world, which means that by September, we will have enough vaccines for every Canadian who wants one. Our top priority remains keeping you and your family safe. I know things are tough right now. Frankly, it's frightening to see cases rise at home and around the world day after day. But you're not in this alone. We continue to be there for you. We're continuing to send millions of pieces of PPE to protect healthcare workers and communities. We will do whatever it takes for as long as it takes. For you, for family, for your communities, we will have your backs. And on that note, I can also confirm that yesterday, the Canadian Armed Forces approved a request for support to the Fort Albany First Nation in Ontario as they deal with the COVID-19 outbreak. The Canadian Rangers will be activated on the ground until at least January 11th. By working together, we will get through this.
As many provinces have announced stricter measures to limit the spread of COVID-19, many people are concerned about what this means for their jobs and for their families. Our government is going to continue to be there for you. This morning, we learned that the Canadian economy lost 63,000 jobs in December, most of which were related to the service industry. Since the beginning of this pandemic, our government acted quickly to support our economy and to directly support Canadians. You can be assured that we're doing everything we can to help you to get through these tough times.
Measures like the wage subsidy are making a real difference for workers and businesses who need it. For a promising new company like StrongPoint in Toronto, the wage subsidy helped keep employees on the payroll when things got tough in the spring. It was a lifeline for them. The same goes for staff at the communication firm, the Humphrey Group. The wage subsidy helped them retain their hardworking employees and get ready for recovery. It's not good news for anyone if local businesses have to close shop for good because of this global crisis. In the second wave, this is not the time to take the foot off the gas. It's the time to keep doing everything we need to ensure that our economy stays resilient and that workers and families can weather this storm. Mercredi,
on Wednesday, Quebec announced a prolongation of its lockdown. It's important for you to know that the federal government is there to support the provinces as they must take difficult decisions. For Quebecers and for all Canadians, measures are in place to help you. There's the wage subsidy that is there for workers and small businesses. For those in need, we changed EI to support a larger number of people. We won't let you down.
Comme je l'ai dit plus tôt,
As I said
les
earlier,
vaccins continuent d'être
vaccines
livrés et
are
on a des
continuing
raisons de
to be
rester
delivered, and
optimistes.
we have reason to be optimistic. But for the
il faut
time
suivre
being,
les directives
we
de la
have
santé
to
publique.
follow public
Restez
health
chez vous,
directives. Stay at
évitez les
home,
rassemblements,
avoid
et
gatherings,
servez-vous de l'application
and
gratuite
use the
Alerte
free
COVID.
COVID alert app.
Ceux qui décident de voyager
Those
à
who decide
l'encontre
to
des avis de la
travel
santé
and
publique
do not follow
doivent
public
faire
health
une
advice
quarantaine obligatoire
must
de 2 semaines
quarantine
en
for 2
rentrant au
weeks
pays.
when they come back to
Si cette
Canada.
quarantaine n'est pas
If this
respectée,
quarantine is not
les conséquences
respected,
légales
there will be
sont
legal
très sévères.
consequences which are very
Depuis
severe.
hier, il est
Since
aussi
yesterday,
obligatoire pour les
it is
voyageurs
now
d'avoir un
obligatory
résultat de
for
test de
travelers to
COVID-19
have a
négatif
negative
avant de pouvoir
COVID-19
prendre
test
l'avion
before they
pour
can
leur retour.
take a return
Quand on se
flight to
compare
Canada.
avec les autres pays, nos mesures aux
Compared to
frontières
other countries,
sont
our
parmi
border
les plus
measures
strictes
are amongst
au
the
monde.
strictest in the world.
Now, more than ever, it is crucial that you keep doing your part to protect yourself, to help our healthcare workers, and to save lives. Wear your mask, avoid gatherings, and use the COVID Alert app. The app has now been updated to work on older models of iPhones, such as the iPhone 5, 6, and 6 Plus. Almost 6 million people have downloaded the app. And of course, the more Canadians use it, the more powerful this tool becomes. So keep it up, and remember, we're all in this together. This morning, I'd like to take a moment to recognize that today marks the one-year anniversary of the Ukraine International Airlines Flight 752 tragedy. As a country, we remember all those we lost, and we mourn with their families and friends. Of the victims aboard that flight, 138 of them were on their way to Canada. To the family members and friends who had planned to pick their loved ones up at the airport, to everyone who was looking forward to seeing your beloved partner, child, or parent, I cannot imagine your pain. Know that you are in our thoughts today. This kind of unthinkable tragedy must never happen again. That's why, over the past year, our government developed the Safer Skies Initiative and worked with partners around the world to help keep civilian aircraft away from dangerous conflict zones. Today, on the first National Day of Remembrance for Victims of Air Disasters, we remember and honor all those we lost. The victims of PS 752, just like the victims of Ethiopian Airlines Flight 302, Air India Flight 182, and other air disasters, will never be forgotten. We will be there for each other through tough times. It's what Canadians do. Whether it's grieving for elders we lost in long-term care homes, whether it's mourning together for victims of international tragedies, or whether it's standing with courageous young people like Isabella Kulak, a member of Cote First Nation, Saskatchewan, who wore her ribbon skirt to school to celebrate her culture last month. Let's remember who we are, people who are there for each other. In tough times, we pull together. We look out for each other. We support each other. It's what Canadians have learned to do through generations of dealing with winter, dealing with vast spaces, being there for each other, being there for our neighbors. We need to make it through this winter now. We need to pull together while staying apart. We need to hang in there. Spring is coming. Summer is coming. It always does. This one will be better if we can pull together right. So stay safe, everyone, and we'll talk to you again soon.
Thank you, Prime Minister. We'll now go to questions from media. We'll start on the phone. One question, one follow-up. Operator.
Thank you. Merci. Première question.
First question.
La Forêt, TVA Nouvelle. À vous.
TVA Nouvelle. Question.
Bonjour, Monsieur le Premier ministre.
Good morning, Prime Minister.
On a senti cette semaine que
This
le
week
ton
we
avait
felt
monté
that
avec
the
le président du
tone
Conseil de la Fédération
has
et
gone
le
up
Premier ministre du Québec concernant
with the
les mesures
Premier in
planifiées
terms of
nationales sur
the
les
national group
CHSLD
on
et
long-term
le
care
fait
homes
aussi
and
qu'il y
the
avait
fact
une
that
concordance
there was a disagreement in terms of what you announced for Quebec and what vaccines for Quebec and what Quebec did. Did you apologize to the premiers for this? Answer, I think it remains extremely important that we work together, that we watch that everyone's doing what they can to help Canadians to get through this crisis. But what Canadians want to see is there are various leaders and politicians working together to ensure that we're doing everything that is necessary to help people. That's exactly the conversation that we had yesterday evening, whether it's our concerns in terms of our seniors and the desire of many provinces to work together to share their best practices to protect the seniors in long-term care homes, or whether it's ensuring that we're sharing all the information in terms of forecasts for vaccine delivery directly to Canadians. Well, we're going to continue to work together, and that's what Canadians expect of us.
I think one of the things that we've seen throughout this pandemic is the need for different orders of government to work together. And yes, we need to make sure everyone is doing their part, and we'll encourage each other to do the best we very much can. But at the same time, we do have a Team Canada approach that makes sure that we're all working together for Canadians, because that's what Canadians want to see. Whether it's by ensuring that all the information is flowing directly to the provinces as we get it on vaccines from the companies. We've clearly stated the predictable schedule for the month of January, and we'll have more information soon for February and March. Or whether it's how we're sharing best practices across the country on successes in long-term care, which is something that every corner of this country is dealing with. We're going to continue to work together for the benefit of Canadians.
Follow-up question. Do you recognize that there can be a delay between the delivery of the doses of the vaccine and when they get to the provinces? Answer. I think that we're ensuring a better efficacy every day. This is enormous mobilization for vaccinations that is underway. What we've started is a good thing, and it even happened a few weeks earlier than what we were expecting. There were roughly several thousand vaccines delivered in December. That was good news, but obviously it takes time to establish processes to deliver vaccines efficiently and safely. Well, there's always a trial period, and we continue to help provinces so they can step up the pace in an impressive way during this weekend and in coming weeks as well. Thank you. Next question.
Merci. Thank you. Next question, Ryan Tumulty, National Post. Line open.
Yeah, good morning, sir. I'm wondering if, in your conversation with the premiers last night, if you were able to give them sort of a timetable for how the vaccine deliveries will ramp up. You mentioned just now that they'll ramp up in February, but I think they're probably hoping for some concrete numbers so that they can plan going forward, especially with the requirement that these vaccines receive a second dose within a certain amount of time.
Yes, that's exactly the issue that we're all working together on right now. The need for predictability allows provinces to schedule deliveries, to schedule inoculations, to have that most efficient possible system. That's why we're pleased that we're able to confirm exactly what doses they'll be getting every single week in January, and we're going to be passing along information on the schedule for February and March soon. We need to get it from the companies themselves. It's not the federal government that decides that. And as soon as we get more information from the companies, we will pass that immediately along to provinces so they can plan. We need to make sure we're being as open and transparent and rapid about it so that we can get vaccinations both to the provinces and from the provinces into people's arms as quickly as possible. And on that, we're all working together. I think it's extremely important
to have as much clarity as possible in terms of the timetable for delivering vaccines. And that's why we're really happy to be able to provide the specific timetable for January and coming weeks. And as soon as we receive the information from these companies for February and March, we will immediately share it with the provinces to allow them to better plan and get organized, and most importantly, to be able to deliver the vaccine more efficiently and quickly to vulnerable people. And that is what we're working on all together.
A follow-up question, Ryan?
Yeah, sir, I just wanted to ask you, in your opening remarks today, you said that the riots at Capitol Hill on Wednesday were incited by the current president, by President Trump. He has a significant amount of support within his own party. There are congressmen and senators who support him. And of course, he's still president for 13 more days. Do you worry about damaging Canada's relationship with the U.S. by those comments?
I think it's extremely important that we be there to defend democracy and the principles that Canadians and indeed Americans and people around the world hold dear. And recognizing that words have consequences, that choices made by people in power can have direct impact not just on behaviors, but on our very institutions, is an important thing.
Next question, operator.
Merci. Prochaine question.
Next question. Mélanie Marquis from La Presse. Question. Hello, Mr. Trudeau. I'd like to go back to what you said in terms of what happened at the Capitol in Washington earlier this week. You said that rioters were incited by the president. How would you define what happened? Was it a coup d'etat? Answer. I think we all saw what the president heard, what he said. We saw the scenes that were horrifying of a violent crowd that wanted to upset democratic institutions in the United States. It reminds us all that the choices we make as politicians and the words we use, how we position ourselves, have a direct consequence, not just on the choices we make as a society, but also the very nature of our institutions. Follow-up question. Yes. Yesterday, as you know, there were extremists such as Proud Boys that were there, and Jagmeet Singh yesterday asked your government to register this group on the list of terrorist organizations. Do you think this will happen? Answer. The decisions in terms of the list of terrorist groups is done in coordination with our state security organizations. This is a first for this country since 2019 that we've last listed right-wing organizations as terrorist organizations. We have other names we've put on it recently, so we're going to continue to fight carefully against such violent extremism that we see that is growingly worrisome across the world and even here in Canada. We are taking this very seriously as a government, and we're going to continue to do everything we can to fight back against hatred and violence.
Glenn McGregor, CTV News. Prime Minister, 1,000 more jobs lost at WestJet today, on top of all the other jobs that have been lost in the airline industry. You've been standing in the spot since the spring, saying that you're negotiating with the airlines to try and help them, and yet here we are in January, still no industry-specific package to help the airline industry. When is it coming, and what is the holdup?
We have invested close to $1.5 billion in support for airline companies in this country to support workers with the wage subsidy, with other measures, because we know that the airline industry is extremely hard hit by the COVID-19 pandemic. People shouldn't be traveling, and that, of course, is a direct challenge for the airline industries to manage through. At the same time, we've made it very clear that we expect people to be reimbursed. We expect regional routes to be protected. We expect certain things from the airline industry, and those discussions about how we're going to make sure that people are protected as we offer supports are continuing.
On vaccines, we're hearing that some countries have been paying a premium to get some of the approved vaccines, with the Pfizer vaccine in particular, Israel paying more than the United States. You've refused to say how much Canada is paying per dose, even though it is the government of Canada's money, and that's not very transparent, and I hope you will change your mind and give more information about those contracts. But I'm curious about whether or not Canada has considered paying a premium price to get more vaccine delivered faster, and if not, why not? Because it seems to be penny wise, pound foolish to not spend more on vaccines if we can get them into people's arms quicker.
From last spring onwards, we knew that securing sources of vaccines would be essential to get Canadians through this pandemic. That's why we worked very early with potential vaccine companies, and were among the first to secure contracts with many of them. We have ended up in the enviable position of having the largest array of access to the top vaccine companies around the world for Canadians, and indeed more doses per capita for Canadians than for just about any other country in the world. Of course, we need to make sure we're getting those doses as quickly as possible, and I can assure you that we continue ongoing conversations with the companies about accelerating the schedule of delivery so we can get Canadians vaccinated as quickly and as efficiently as possible. And the Minister of Procurement, Anita Anand, will be at the noon press conference and can answer further questions on this.
Hi, Prime Minister. Tom Perry with CBC. You've been talking about getting all Canadians, or anyone who wants a vaccine, vaccinated by the fall. Are you still confident about that? And I just want to know, are you sort of basing that on vaccines that have yet to be approved?
We have secured a very strong array of different vaccines, potentially as they move forward. The Pfizer vaccine, the Moderna vaccine are approved. The Johnson & Johnson, the AstraZeneca are in the Health Canada rolling evaluation process right now. The experts who are in charge of our vaccine portfolio and indeed the schedule are confident that we are going to be able to vaccinate every Canadian who wants it by September. That will be significant in terms of getting through this pandemic and making sure that next winter looks very different from this one. But indeed, as vaccines roll out, we're hoping for 3 million Canadians to be vaccinated by the end of March. And into the spring, we hope to see many, many more millions of Canadians vaccinated as well. But we hold to September as the date in which every Canadian who wants one will be able to have gotten a vaccine.
En français?
Answer in French.
Nous nous sommes commis à avoir
We're committed
tout le monde au Canada qui veut
having all Canadians who wish to have a vaccine have one by September. It'll be important to be able to get to that point. We have many doses under contract with various companies, and experts who are managing our vaccine system are confident that we will get to our objective for September 2021.
And on the events this week in Washington, you've met with Donald Trump, you've spoken with him, you've negotiated with him. I'm wondering if you ever expected Donald Trump's presidency to end this way.
I think throughout the past 4 years, we have learned as a country and indeed as a world that the Trump administration was unpredictable and posed certain challenges, but at the same time, we've been able to work through in a responsible way, defending Canadian interests and moving forward in a way that always makes it very clear what our values are. We were able to renegotiate NAFTA in a way consistent with our values and our approaches, and defend Canadian interests significantly in that area and in many other areas. Obviously, there is going to be much said and written about in the history books over the coming years about this time, but my focus has always been and will always be how to make sure Canadians are best represented, best defended, and best supported as we move through this world. And that's what we've done with this administration and what I'm very much looking forward to doing with President Biden as of a couple of weeks from now.
answer in French. I think that Canadians have always expected our government to defend our values, our principles, and most importantly, our interests in terms of the U.S. government, which was hard to predict, and the U.S. government also presented challenges in terms of our relationship. But I'd like to remind you that we were able to negotiate NAFTA in order to defend our values and even create benefits and opportunities for Canadian workers and companies, even under a regime that was somewhat difficult. And we're going to continue to remain focused on Canadian interests in the years to come with the new President Biden when he will take office in a couple of weeks.
Canadian Press. Following on that, how concerned are you or were you that President Trump's exhortations on Wednesday would be heard by groups like the Proud Boys and others in Canada? And what concerns did you have about what President Trump was saying about creating potential threats to Canada's national security?
Well, we know that even as we watch with extreme concern everything unfolding in the United States over these past few days, that we are not immune to that in Canada, that we have a responsibility as Canadians to continue to lead with respect, to engage substantially with different points of view, and to never resort to violence as a way of impacting public discourse. That is something that Canadians have recommitted to across the country over these past days, and we will continue to be extremely vigilant to remember that the choices we make as leaders, as politicians, have consequences. What we choose to say, what we choose not to say, how we choose to say it, does have an impact on Canadians, encourages people to do some things, discourages them to do others. We need to be more responsible, all of us, in how we approach civil society and community engagement. And that's something that I think we are all rededicated to after seeing what can happen in the United States and elsewhere. I
think it's extremely important to remember that we all have a responsibility as Canadians, but also as leaders, to carefully choose our words, to make the right choices, to bring people together and to respect our various points of view, and to never leave room for hatred or extremism and violence. We have to learn from what happened in the U.S. and make sure that we are respecting each other. We have to work together, bearing in mind that we won't always agree on everything, but we always have to agree on the need to condemn hatred and extremist violence.
Follow-up on a question earlier about other countries such as Israel perhaps paying more for vaccines and changing the economic dynamic of all of this. Do these actions undermine Canada's efforts to negotiate fair contracts to purchase these products? And are you considering changing the terms of those contracts or trying to pay more to do what you need to do because the landscape is changing?
I know that Minister Anand will have more to say because she's the one who is in direct contact with the vaccine companies as we work to bring more doses more quickly to Canada. But we have excellent relations with the various vaccine companies, and the way we are demonstrating our ability to deliver for Canadians across the country, this really big vaccination program continues to be a proof point on the fact that we should be continuing to receive more and more doses quickly as we work with companies from around the world. Merci beaucoup tout le monde.
Thank you very much, everyone. be able to present some information after the Prime Minister's press conference earlier. We will have the Minister of PSPC with us, and we will also hear from the Dr. Tam, who is the Chief Public Health Officer, as well as Dr. New, who is the Deputy Public Health Officer of PHAC. We will also hear from Major General Fortin, who is in charge of deployment, and also Dr. Sharma, who works for Health Canada. Before I give the floor to my colleagues and to Minister Anand, I would first like to remind you of a few important points. The interpreter would like to note that the sound quality is very poor. I would like to mention our U.S. allies who are going through difficult times, and also send our sympathies to the families and the loved ones of the victims of Flight PS 752, which was shot down a year ago. There are many people here in Canada and in the U.S. as well that were affected. We also heard from Minister Trudeau today a message of solidarity and of cooperation.
For this reason, I would like to turn to Minister Anand, who will provide us remarks on the vaccine delivery and administration within Canada.
Thank you very much, Jean-Yves. Before I begin, the interpreter would like to note that the sound quality is poor and is not allowed for interpretation at this time.
Je voudrais remercier tous les gens sur la première ligne pour leur travail important. I want to thank sincerely the health professionals across the country for their work as they continue to protect Canadians on the front lines. 2020 was extremely hard on so many fronts. And while we begin 2021 in the midst of a very serious situation, one that requires more resolve and sacrifice than ever before, we have real reason for hope. Aujourd'hui, je voudrais prendre quelques instants.
The interpreter would like to note still that the sound quality does not allow for interpretation at this time.
Today, we would like to take a few moments to update Canadians with regards to vaccines. I want to start by saying, while Canada has secured one of the most diverse and robust vaccine portfolios, we are now focused on getting doses into Canada at the earliest possible moment. That is precisely what we did last month when we secured early delivery of the Moderna and Pfizer-BioNTech vaccines, just as they were being authorized by Health Canada. Vaccine doses are now arriving at a steady pace, and we are on track to receive a total of over 1 million doses by the end of this month. I know many of us would like to see that rhythm increase. The rate of vaccine deliveries is increasing and will continue to do so. We are on track to receive 6 million doses by the end of March, 1.3 million doses of those by the end of January, 1.9 million doses by the end of February. These deliveries are being made on a schedule shared publicly and with the provinces. And Major General Fortin will expand on these delivery numbers in a moment. PHAC is publishing the deliveries, sharing those schedules with the provinces and territories. I want to assure Canadians that I, along with my colleagues at PSPC, are working nonstop to accelerate vaccine delivery schedules. Due to the earlier start of the deliveries in December. We are well on track to receive enough vaccines for everyone by the end of September. And let's remember, we are now at the beginning of January. I believe it is also important to remember that all of us at every level of government, in opposition, in media, and across the country, want the same thing: an end to the pandemic and a return to our normal lives. We are pushing the exact same direction, and we must continue to collaborate. Together, we will get through this. Thank you.
Thank you, Minister Anand. Dr. Tam, please.
And good afternoon. Bonjour à toutes et à tous.
Hello,
there
everyone.
have been over 635,000 cases of COVID-19 in Canada, including 16,579 deaths and over 80,250 active cases across the country. Nationally, the average case count is at 7,672 new cases being reported daily over the past week, and the number of people experiencing severe illness continues to increase. There are an average of 4,336 individuals with COVID-19 being treated in Canadian hospitals, and over 800 of whom are in critical care. And 136 deaths are being reported each day. Canada continues to monitor for virus variants that may be associated with an increased risk of spread. To date, there have been 14 cases of a variant virus first reported in the UK, United Kingdom. As the rollout of COVID-19 vaccines proceeds across Canada, including during this initial phase to protect those at highest risk of severe outcomes or exposure, keeping Canadians up to date with timely, factual information is a top priority. The Public Health Agency of Canada is working closely with provinces and territories, Health Canada regulators, and other federal jurisdictions to collect information on COVID-19 vaccine safety. Starting today, the information will be posted on canada.ca and updated weekly on Friday afternoons. The weekly COVID-19 vaccine safety report will include information on adverse events following immunization, which involve any health problem that happens following immunization, but is not necessarily caused by the vaccine. Adverse events can range from common mild events such as soreness at the site of injection or a slight fever to more rare serious events such as a severe allergic reaction. Canada has a robust vaccine safety monitoring system in place, and all serious events will be investigated. As of January 1, there have been over 1,015,000 doses of COVID-19 vaccines administered across Canada, with 9 adverse events reported. There have been no unexpected vaccine safety issues identified to date. As with any new undertaking, we all have questions. These weekly reports on COVID-19 vaccine safety aim to provide Canadians with regular access to credible information that will assist them in making informed and confident decisions on vaccination for themselves and their families. As always, I call on healthcare providers to listen to Canadians' questions and concerns and to encourage ongoing dialogue to further support vaccine confidence. The progress we have made across Canada and around the world on vaccines is inspirational, but everything we've achieved is the result of consistent, persistent, and collective efforts. We've worked hard and we've kept up the pace. Though I know we are all eagerly awaiting more hopeful days ahead, we've still got a ways to go. We all need to maintain core public health practices, hand washing, masking, and spacing away any and all opportunities for COVID-19 to spread. And we wait for our place in the vaccine. As we wait for our place in the vaccine queue, let's continue to support those who need to be protected most urgently and do our part to help all those working to make vaccines available for all Canadians in the months ahead. Thank you.
Bonjour à tous et à toutes.
Hello, everyone.
Il y a eu plus de 635
There have been
000
over
cas de COVID-19
735,000 cases of COVID-19 in Canada,
16
including 16,579 deaths and over 80,250 active cases across the country. On average, daily, 7,670 new cases were reported over the past week, and the number of people experiencing severe illness continues to increase. There's an average of 4,336 individuals with COVID-19 being treated in Canadian hospitals, and over 800 of whom are in critical care. 132 deaths are being reported each day. Canada continues to monitor for virus variants that may be associated with an increased risk of spread. To date, there have been 14 cases of variant virus, first reported in the U.S. And as the rollout of COVID-19 vaccines proceeds across Canada, including during this initial phase to protect those at higher risk of severe outcomes or exposure, keeping Canadians up to date with timely factual information is a top priority. The Public Health Agency of Canada is working closely with provinces, territories, Health Canada regulators, and other federal jurisdictions to collect information on COVID-19 vaccination coverage and safety. Starting today, this information will be posted on canada.ca and updated weekly on Friday afternoon. The weekly COVID-19 vaccine safety report will include information on adverse events following immunization, or AEFI, which involve any health problem that happens following immunization, but is not necessarily caused by the vaccine. Adverse events can range from common mild events, such as sores at the injection site or a slight fever, to more serious events, such as severe allergic reaction. Canada has a robust vaccine safety monitoring system in place, and all serious events will be investigated. As of January 1st, there have been over 115,000 doses of COVID-19 vaccines administered across Canada, with 9 adverse events reported. There have been no vaccine safety issues identified to date. And as with any new undertaking, we all have questions. Weekly reports on COVID-19 vaccine safety aim to provide Canadians with regular access to credible information that will assist them in making informed and confident decisions on vaccination for themselves and their families. And as always, I call on healthcare providers to listen to Canadians' questions and concerns, and to encourage ongoing dialogue to further support vaccine confidence. The progress we've made across Canada and around the world on vaccines is inspirational, but everything we've achieved is the result of consistent, persistent, and collective efforts. We've worked hard, and we've kept up the pace. Though I know we're all eagerly awaiting more hopeful days ahead, we've still got a ways to go. We all need to maintain core public health practices such as hand washing, wearing a mask, and avoiding all opportunities for COVID-19 to spread. As we wait for our place in the vaccine queue, let's continue to support those who need to be protected most urgently, and do our part to help all those working to make vaccines available for all Canadians in the months ahead. Thank you very much. Thank you very much. And now I will invite Major General Fortin to make his remarks. Thank you very much, and hello, everyone.
We're pursuing a deliberate and phased approach to Canada's COVID-19 immunization strategy. This initial phase, or phase 1, is characterized by a limited and steady supply of vaccines for much of January, February, and March. before we see a significant ramp up leading into April and the rest of the second quarter of the year. That said, we're working with our procurement partners and manufacturers to accelerate the delivery of approved vaccines as much as possible. As previously mentioned, a total of 6 million doses are expected to be distributed by end of March. Let me speak to Moderna and then Pfizer-BioNTech. Shipments of Moderna arrive every 3 weeks in this country. By the end of next week, 171,600 doses will be delivered, with numbers per provinces and territories similar to what we experienced with the last shipment. The first week of February, we anticipate another quantity, approximately the same, 170,000 doses. The quantities will begin to scale up to 250,000 in the month of February, and by end of March, we'll have 1.24 million doses delivered. So by the end of March, we expect to have distributed 2 million doses of the Moderna vaccines. So those are the numbers that we have today. We are working with Moderna to accelerate the availability of vaccines, and that also applies to Pfizer-BioNTech. Pfizer-BioNTech deliveries will continue on a weekly basis. This week, 124,800 doses were delivered. That finished today, and they were delivered to 68 different vaccine delivery sites across the nation. For the remainder of January, we expect approximately 208,650 doses to be delivered to the provinces weekly. In February, we expect to receive between 366 and 367,000 doses of the Pfizer-BioNTech vaccine per week. Shipments in February include, therefore, a 60,000 doses more per week than we originally planned, and represent an advance on Canada's March allocations. So the total expected of Pfizer in February is 1.4 million doses. So we're working with our procurement partners and the manufacturer to confirm Pfizer-BioNTech allocations for March. And by the end of the first quarter, we'll have received at least 4 million doses of that vaccine. As our collective understanding of these new vaccine evolves and the manufacturer update their product monographs and instructions, we're able to adapt how and where we distribute and administer vaccines to Canadians. Within the past week, Pfizer-BioNTech has updated their guidelines and procedures for the transportation of their vaccine in a thawed state and in smaller tray sizes. So this means that more options for that vaccine to be transported and administered to more sites and in smaller amounts, and that helps tremendously provinces in the administration of the vaccine. This complemented with our inherent flexibility to deliver to an increased number of vaccine delivery sites across the Canadian landscape, as identified by the provinces, and our growing capacity to support multiple cold chains is very good news. The allocation forecast will continue to fluctuate on a regular basis. This is an expected result of ongoing and persistent efforts on the part of Government of Canada to work with manufacturers to accelerate the availability of approved vaccines and of natural disruptions that can occur during the vaccine production process. We'll update our federal, provincial, territorial, and Indigenous partners and the public regularly on allocation forecasts as they evolve. So we'll continue to work together with all our partners to ensure that we have collective capacity to immunize as rapidly as possible and as safely as possible. Maintenant en français, nous poursuivons notre approche délibérée et par phase de la stratégie de vaccination contre la COVID-19 du Canada. L'étape initiale, la phase 1, consiste en un approvisionnement limité et constant de vaccins pour la majorité des mois de janvier, février et mars, avant de connaître une augmentation accrue des doses au début du deuxième trimestre, en avril. Nous travaillons donc avec nos partenaires
We are
en
working with our
approvisionnement et
procurement
les
partners
fabricants
and
pour accélérer
manufacturers
la
to
livraison de
accelerate the
vaccins
delivery of
homologués
approved
autant que
vaccines
possible.
as much as
Comme mentionné
possible.
précédemment, un
As
total
previously
de 6
mentioned,
millions de
there's a
doses est donc
total of
attendu
6 million doses
d'ici la
expected
fin ou le 31 mars.
by March 31st.
Je vais parler premièrement Moderna et
First, I'll
ensuite
talk
en
about
détail de
Moderna, and
Pfizer
then I'll move on to
Alors, les envois du
Pfizer
vaccin de
BioNTech.
Moderna
Shipments of Moderna
arrivent
vaccines
tous
arrive
les
every
3 semaines.
3 weeks.
D'ici la fin de la
By the
semaine
end of
prochaine,
next week,
on s'attend d'avoir livré
we expect
171 600 doses, dont
600,000
le
doses
nombre par
to be
province et
delivered,
territoire
with numbers per province and territory
seront
similar to the
semblables au
last
dernier renvoi.
shipment.
Nous prévoyons aussi livrer
We also expect
à peu près la même chose, 170
roughly the
000
same thing,
doses
namely
de ce vaccin au cours de la
170,000
première semaine
doses
de
of this
février.
vaccine during the
Les
first week
quantités
of
du vaccin
February.
Moderna commenceront alors à
Quantities
augmenter.
of
Elles devraient
Moderna vaccine will
atteindre
then
environ
begin to scale
250
up
000
with 250,000 doses expected
d'ici
by
la
the
fin
end of
février
February
et
and
1,24 million de
1.24
doses à
million
la fin
doses
mars.
in mid-March.
Par conséquent, nous
So by
prévoyons
the end
avoir
of March,
distribué un total de 2
we
millions
expect
de
to have
doses
distributed a
du
total of
vaccin
2
Moderna
million
d'ici le
doses
mois
of the
d'avril. Nous
Moderna
continuons de travailler,
vaccine.
bien entendu, avec
We
Moderna
continue to
afin
work with
d'accélérer la
Moderna,
disponibilité
obviously,
de
to
vaccins.
accelerate the
Et
supply of vaccines.
nous continuerons d'informer
We will
à
continue to
mesure que
inform
les chiffres
Canadians
sont
as
plus
figures
stables.
are more
Maintenant, sur
stable. Now,
Pfizer
in terms of
BioNTech,
Pfizer
les livraisons
BioNTech,
du vaccin se poursuivent
these
à
vaccine
chaque semaine.
deliveries will continue on a
Nous
weekly
avons livré
basis.
cette
This
semaine
week,
124 800
124,800
doses du
doses
vaccin
were delivered
à
to
68 sites
68
de livraison
vaccine delivery
à travers le
sites
pays.
across the country.
D'ici la fin du mois de
For the
janvier, nous
remainder of
attendons à
January, we
livrer
expect
environ
approximately
208 650
200,650
doses
doses to be delivered
aux provinces
to the
chaque
provinces
semaine.
weekly.
En février, nous
In February, we
attendons
expect to
à
receive
recevoir
between
entre 366 000 et
366,000 and
367 000, dépendant de la
367,000
semaine,
doses
doses
of
du
the
vaccin de
Pfizer
Pfizer
BioNTech
BioNTech
vaccine
à
per
chaque semaine.
week.
Les envois que nous recevrons
Shipments
en
in February
février
include
comprennent donc 60 000
therefore
doses de plus que ce que nous avions
60,000 more
initialement
doses per
prévu
week than
pour le mois de
initially
février.
planned
Alors,
and
c'est une
represent
avance
an
sur
advance on
l'allocation prévue
Canada's
pour le mois de
March
mars.
allocations.
Le total attendu donc de Pfizer
Therefore, the
BioNTech
total of the
en février
Pfizer
est de
BioNTech
1,4
vaccine
million.
for
Nous travaillons avec nos partenaires et
February
manufacturiers
is
pour confirmer
1.4.
les
March
allocations de
will
Pfizer
be more
BioNTech pour le
challenging.
mois de mars. Et d'ici la fin de ce premier trimestre,
And
nous
by the
aurons
end
donc
of this
obtenu
quarter,
au moins
we will
4
have
millions de
obtained at
doses
least
du vaccin
4
Pfizer BioNTech.
million of this
En ce qui a trait
vaccine.
au transport du
In
vaccin.
terms of the
À
transportation of the
mesure que nous avons une
vaccine,
meilleure compréhension de ces
as our
vaccins
collective
et que les
understanding of these new
fabricants mettent à
vaccines
jour les
evolves
monographies
and the
et les
manufacturers
instructions
update their
sur leurs
product
produits,
monographs and
nous
instructions,
pouvons mieux déterminer
we
de
are
quelle
able
façon
to
et dans
better
quelle région nous
determine
distribuerons le
how
vaccin
and where we
aux
will
Canadiens et
distribute and
comment nous
administer
organiserons son
vaccines to
administration
Canadians.
avec les provinces. Au cours de la dernière semaine,
Over the
Pfizer
past
BioNTech
week,
a
Pfizer
modifié les
BioNTech has
directives et les
updated their
procédures de
guidelines
transport
and
de son
procedures
vaccin
for the
à l'état
transportation of
dégelé,
their vaccine
ce
in a
qui,
thawed state
ce qui est
and
organisé en
in
plus petite
smaller
quantité,
tray
et ce qui
sizes.
permet de faciliter le transport.
This
Ça nous
means
permet donc de transporter des
that
plus petites quantités
we
plus
can
facilement
transport smaller
vers
quantities
les endroits
easier to areas
les endroits où les provinces seront en mesure d'administrer le vaccin.
where provinces can administer
En
the
plus de la
vaccine.
flexibilité que nous avons de faire la livraison à un
This
nombre accru de sites de vaccins
makes our flexibility greater
dans
to
toutes les
deliver an
régions du
increased
pays
number of
et
vaccine
de renforcer notre capacité
sites across
d'appuyer
the Canadian
les chaînes de
landscape
froid.
as our
Les
growing
modifications
capacity to
apportées par le
support
fabricant sont une
multiple
très bonne nouvelle pour
cold
les Canadiens et
cold
permettent de mieux
chains.
gérer la
And this is
stratégie
good
de
news for
distribution
Canadians and our
du
immunization
vaccin.
strategy.
En ce qui a trait à la fluctuation des
In
doses,
terms of the fluctuation in the number of doses,
les prévisions d'allocation continueront de fluctuer régulièrement.
our
On s'attend à ce que ça
forecast will
arrive
continue to
car
fluctuate regularly,
le
and we
gouvernement du
expect
Canada poursuit ses efforts et travaille de
our
façon
government to
continue et
pursue
incessante
its
avec
efforts
les
and is
fabricants
working
afin
closely with
d'accélérer la
manufacturers
disponibilité
to
des vaccins
accelerate the
approuvés.
availability of vaccines.
Les prévisions d'allocation
Our
peuvent
allocation forecasts
certainement fluctuer
will
à
certainly
cause des changements qui
fluctuate
peuvent survenir durant le
as
processus
changes
de production
occur
des
during
vaccins. C'est
the
quand même un nouveau vaccin.
vaccine production
Nous
process.
informerons
It is a new
régulièrement les
vaccine,
partenaires
and
au
we will
niveau
continue to work with our
fédéral,
federal,
provinciaux,
provincial,
territoriaux et
territorial, and
autochtones,
indigenous
ainsi
partners,
que le public, les prévisions
as well as the
d'allocation
public,
au fur et à mesure de leur évolution.
as
Alors, en
things
conclusion,
evolve.
nous
In conclusion,
continuons
we will continue
de travailler avec tous nos
to
partenaires
work with all our
pour nous
partners
assurer de
to
notre
ensure
capacité
that our
collective
collective
ensemble
capacity to
de
immunize permits available vaccines
les vaccins à
to be
disponibilité
used
des provinces
to
et
greatest
territoires
possible effect
afin d'obtenir des résultats le plus rapidement possible.
as quickly as possible. Thank you.
Thank you, Major General Fortin, for this excellent summary and this encouraging news. I would like to invite Dr. Sharma to speak. Dr. Sharma est la conseillère médicale en chef de Santé Canada.
Dr. Sharma,
On va absolument commencer avec des questions.
Health Canada. We'll start with questions.
Merci pour les discours.
Thank you very much for these speeches. We'll start with 3 questions from the phone, and then we'll take questions from the room. First question.
Merci. Thank you. Please press star 1 if you have a question. Veuillez appuyer sur étoile 1 si vous avez une question. Notre première question est de Madeleine Blais-Morin.
First question from Madeleine Blais-Morin from Radio-Canada. The floor is yours.
Oui, bonjour.
Question. Hello. When you talk about the target for September 2021 for all Canadians to be vaccines, I'd like you to be more specific. Does this mean that Canada will have the necessary doses to vaccinate all Canadians, or does this mean rather that Canada will have vaccinated all Canadians by this point?
Madame Anand.
Ms. Anand.
Thank you so much. I hope you can hear me. The numbers that we have been providing, and in particular our procurements of a minimum of 214 million doses and a total of up to 398 million doses with options, are dependent upon Health Canada approval of certain vaccines. We know that Health Canada has approved Pfizer and Moderna. We know that 2 additional vaccine candidates are in rolling review with Health Canada, being AstraZeneca and Johnson & Johnson. And so the numbers that we are using for our predictions are based on the assumption that the vaccines that we have procured will indeed be approved by Health Canada. Je voudrais aussi ajouter
I would also like to add
qu'il y a beaucoup de
that
travail à faire
there's a lot of work to be done
avec les fournisseurs
with
pour
the suppliers to
assurer,
ensure
que
that
ils peuvent donner
they can
l'information
provide the necessary
nécessaire à
information
Santé Canada
to Health Canada
pour l'approbation.
so that their vaccine can be approved. We're working hard with manufacturers in this respect. Thank you very much.
Dr. New, peut-être je peux ajouter quelque chose
Dr.
aussi
New, I would also
de
like to add
perspective de
something
santé publique.
in
Je
terms
pense que la
of
question
our
c'est vraiment
prospects.
visé sur le
Our
point
question
que
is really focused
on est
on,
sur le bon chemin
well, we're on the
pour
right
être
path
capable d'offrir
to
les
be able
vaccins
to
homologués à tous les Canadiens
approved
qui
vaccines
sont
to all
éligibles
Canadians
pour les
when they're
vaccins
eligible
homologués d'ici à la fin du mois de
for
septembre. Pas
approval
forcer la
by the end of
vaccination, c'est toujours une question
September.
de
Vaccination is always a question of what's being offered,
de dire aux Canadiens,
and to
on
tell
a les vaccins,
Canadians that we have the
on encourage
vaccines.
les Canadiens
So we
à être
encourage
vaccinés,
Canadians
mais
to
on
be
peut pas
vaccinated,
forcer. C'est
but we're
pas
not
une
going to
question
force
de
anyone to do
vacciner, c'est
so.
toujours une question d'offrir la vaccination.
It's always a question of offering the vaccines.
Suivi.
Follow-up question.
Pour que ce soit vraiment clair pour moi.
Things to be really clear.
Est-ce que à partir de septembre, on
As
va
of
avoir
September,
la possibilité de vacciner
will we have
tous
the
les Canadiens,
possibility of
ou
vaccinating
à la
all
fin de
Canadians,
septembre,
or
on va
by
avoir
September,
vacciné tous les
will
Canadiens
we
qui le
have
souhaitent?
vaccinated
Parce
all
qu'il peut
Canadians
y
who
avoir
wish
une
so?
différence.
There could be a difference
À
here.
partir de, est-ce qu'à la fin de septembre, on a
By the
les
end of
doses
September, will we
nécessaires,
have
ou
the
à partir
necessary
de la fin de
doses,
septembre,
or will by the end of September
on va
will
avoir vacciné
we
ceux qui
have
veulent?
vaccinated
Il y a une
everyone?
différence entre avoir
There's a
les
difference
doses et
between
avoir
having the
vacciné les
doses
Canadiens.
and having vaccinated everyone.
Oui, c'est vrai. Et merci
Yes, that's
pour
true.
la question.
And thank you for your question.
Je voudrais commencer
I'd like to
par
start
dire
by
que,
saying,
à mon avis,
in my opinion,
c'est nécessaire de penser à cette
we have to
opération dans 2 phases.
think about this in 2 phases. First,
nous devons avoir les doses
we have to have the doses here in Canada.
et aussitôt que possible,
And as soon as possible,
nous allons donner ces doses
we are going to give these doses
aux provinces et
to the
territoires.
provinces and
Ça,
territories.
c'est la deuxième phase.
That's the second phase.
Et par l'avis de le gouvernement fédéral, nous
And in terms of the federal
assurons
government, we're going to
que
ensure
les doses vont
that the
arriver
doses
ici
will
au Canada
come here to Canada, and the provinces and territories must do their share in terms of these operations. And perhaps the General Major Denis Fortin could add something here as well. Certainly, thank you very much, Minister. I can say that I have confidence, first, that the quantities will increase significantly as of April if these vaccines are approved. There are other vaccines that could be available when they're approved, but I'm working on what's been approved, and these doses will increase significantly in April. Now, the provinces and territories are developing their expertise in terms of handling and administering these vaccines. And these vaccines are more complex than what we've seen in the past. It needs experience and expertise, and this is increasing every day. There is no reason to believe, and as my colleagues also feel, I believe that the provinces and territories will considerably ramp up their ability to administer vaccines in the coming weeks and months. And together, because this is a team effort, we'll continue to look at how we can prioritize equipment that will facilitate this administration provincially and distribute this equipment to best meet needs and cover areas where there are some vulnerabilities. And we have to encourage the sharing of best practices and use federal contracts as much as possible with respect to distribution to facilitate the work of provinces and territories. Very quickly, the question was very relevant. There's always a closer cooperation between the government and the provinces in terms of delivering the vaccines, and the provinces and territories are administering them. And like Prime Minister Trudeau said, and as Mr. Fortin said, these two things will be happening in parallel.
So I'll repeat this quickly in English. I think we have no reasons to doubt that provinces and territories will significantly ramp up their ability to administer vaccines over the next weeks and months as we collectively gain more knowledge and experience with administering vaccines, and certainly our role in terms of distributing at scale to those more remote areas. So provinces and territories can leverage a federal logistics service provider contract to maximum extent. We can prioritize distribution of cold chain enabling equipment, freezers, and all these other things that will help the provinces and territory to administer at scale. And as more and more vaccines become available, it's important to encourage the sharing of best practices, and that's already ongoing with the conversations that we have amongst all key partners.
It's Dr. Maybe I'll just add a bit of a public health perspective. I think that question about what happens by the end of September, I think we are vaccinating people right now, obviously into priority populations, and I think as more and more Canadians become vaccinated throughout the country, confidence will grow. People will see a neighbor, a friend, a coworker is getting vaccinated, and so as the summer months roll on, by the time we hit September, hopefully, like I said, there's just be a few more pockets in terms of Canadians who, for whatever reason, have not taken up the offer yet, and then we'll still obviously reach out to offer the vaccination to those remaining Canadians who are obviously eligible to get vaccinated. So I think that's the overall game plan. And to date, obviously, the federal government is working very well with our provincial and territorial counterparts, and things are unfolding as Major General Fortin has said, and I think it's only going to unroll even faster and better as we proceed further. Thank you.
Next question, please.
Thank you. Merci. Our next question is from Ryan Timothy from the National Post. Please go ahead. À vous la parole.
Yeah. Hi there. I was hoping to get a little bit more clarity around this September goal. My understanding is that you expect Pfizer and Moderna to deliver their combined 60 million doses by September, which I think would cover off the vast majority of Canadians who want a vaccine, especially factoring in that people under 18 can't currently receive it. It's not approved for them. Is that correct? Are you expecting to have all of those Pfizer and Moderna vaccines here by September?
I'll start with that. Thanks, Ryan. Nice to hear your question. I will say that our thinking in terms of providing the data to Canadians is based on the expectation that we will have additional vaccines approved. And so the numbers that we've provided take into account a number of vaccines, not only the Pfizer and Moderna vaccines. By the same token, we wanted to be sure that we would be able to have approved vaccines in place to ensure that Canadians can be vaccinated. And that's one of the reasons why we moved to exercise those 20 million additional Moderna options prior to the holidays. And so it's really a multi-pronged approach to make sure that we have vaccines in place for all Canadians this year prior to the end of September.
Follow up, Ryan?
Yeah, so I'm still not clear, though. Do you expect the 60 million doses from Pfizer and Moderna to be delivered by September as part of this goal of vaccinating everyone who wants a vaccine by September? And also, I guess, I'm wondering if you can give us an update, too, on where we are at with the approval. If these vaccines are key, where are we at with the approval for AstraZeneca and Johnson & Johnson?
Okay, well, I will take the first question since I'm not Health Canada, and it's difficult for me to provide an update on the regulatory process, given that I'm not involved in it. But in terms of the Pfizer and Moderna numbers, yes, in large part, we are planning that Pfizer and Moderna doses will comprise the number of doses required to make sure that any Canadian who wishes to be vaccinated will be vaccinated by the end of September. Again, we are in conversation and negotiation with the vaccine suppliers, with Pfizer and Moderna every day. I have spoken with the CEOs of both companies this week already, and I will continue to engage with them, as will my department, to move up doses from Q3 to Q2, from Q2 to Q1. We are pressing on all fronts to do whatever it takes to make sure that we have vaccines in this country as soon as possible.
Thank you, Minister Anand. I am not in the room and therefore cannot see if Dr. Sharma would like to provide precisions on the regulatory process.
I would. Thank you very much, Minister. So this is Priya Sharma from Health Canada. So the question is regarding the rolling reviews of both the Johnson & Johnson and AstraZeneca vaccines. So both of those are under review. They are prioritized, expedited reviews, and the teams are actively working on them. We're also working internationally with our counterparts on those reviews. With respect to the Johnson & Johnson review, we are expecting some key clinical information coming in from clinical trials that are expected to read out around the end of January or into February, but that's been a little bit variable. And we also need some key manufacturing information. So there are still large chunks of information on that submission that we're expecting. With respect to AstraZeneca, we have done a review of the data that we have so far, and we are working with our key regulatory partners, including the European Medicines Agency, as well as the US FDA. And there are still some clinical questions that we need to look into. So on the safety side, on the efficacy side, as well on the quality side, on the manufacturing side. There is a large AstraZeneca study that's ongoing in the United States. and we still are expecting to get some information from that study. So that's almost 40,000 participants. So the reviews are progressing. They're progressing well. As we said, we're working very closely with our international partners, but there's still some questions to be sorted through before we make a final decision. As we get closer to making the final decision, absolutely we'll share that information.
Okay, we'll take one more question on the phone and then turn to Ron.
Thank you. Notre prochaine question est de Catherine
Our next
Lévesque
question
de la
from
presse
Catherine
canadienne. À vous la parole,
Lévesque,
please go ahead.
Canadian Press.
Oui, bonjour tout le monde.
Hello, everyone.
Ma première question,
My
c'est
first
pour
question
le major général
is
Fortin.
for
Juste
General
pour le
Fortin.
bénéfice là, de mes collègues à la radio et à la télé, bon, je comprends
My
que vous avez donné
colleagues
beaucoup de chiffres là,
on
sur
TV and
les
radio,
livraisons
well,
à
they talked
venir,
about a lot
mais
of figures
d'ici la fin du mois de
in
mars, je
terms
ne sais
of
pas si vous pouviez juste me dire,
upcoming
on peut s'attendre à
deliveries.
combien
By the
de
end of
doses
March,
au
how many
total
doses in
de
total
Pfizer, combien
can
de
we
doses
expect
au
from
total de
Pfizer
Moderna,
and
et
Moderna?
puis répondre en une phrase là-dessus. Et est-ce que
Can
vous
you
avez eu une
answer that?
indication que
And
ces
also
chiffres
give us
pourraient augmenter de
indication
façon
as
substantielle
to
dans la phase 1?
whether the
Merci.
figures will increase considerably in phase 1.
Oui, alors, je fais rapidement mes mathématiques en public.
I'm just doing my math quickly in public here.
C'est
It's in February, 1.4 million doses from Pfizer.
Et puis d'ici la fin
And by the end of March,
on s'attend
we
d'avoir
expect to have
atteint le 4 millions de
reached
doses
4
de
million
Pfizer.
doses from Pfizer.
Le 2
We
millions
expect
de
to reach
doses
2 million doses
de Moderna
from
d'ici la fin
Moderna
mars
by the end
également.
of March.
Et étant donné qu'on a eu
Given
170 000
we had
présentement et 171 000
160,000
la semaine
already,
prochaine,
and
alors
we'll have
il y a environ
171,000 next
1,65
week, we're
millions
expecting
de doses qui s'en
1.67
viennent au cours des
million
deux prochains mois.
doses coming in coming months.
Okay, suivi.
Follow-up question.
Oui, merci beaucoup
Question,
pour ces
yes.
mathématiques. Et
For that,
puis,
thank you
ma
for that
question suivie,
math.
c'est pour vous,
And my
Monsieur
follow-up question is for
Duclos.
Mr.
Bon, je vais la poser à
Duclos.
Monsieur Leblanc, mais il n'est pas là.
Mr.
Alors,
Leblanc
je
is
me
not
permets
here, so I'll
de
ask
vous
you.
relancer sur ce 1 000 là, pour les
I'd like you to
voyageurs
talk
qui
about
a
the
fait,
$1,000
qui a causé la controverse. Là.
for
Le gouvernement
travelers.
a dit
That
qu'on
was
allait avoir des
controversial.
nouvelles pour
We're
changer la loi
expecting
d'ici la fin
news
de la
to
semaine.
change the
On est
legislation by the end of
vendredi,
the
alors je
week,
me demandais, est-ce que vous
and
avez
it's
quelque
already
chose à nous
Friday.
annoncer
So do you have
aujourd'hui?
anything to announce today
Sinon,
about that?
où en êtes-vous là, dans les
And where
discussions
are
là,
you
pour
in terms of
modifier la loi sur la
discussions
prestation?
to amending the legislation on that
Merci
benefit?
beaucoup,
Thank you very much for your question.
Probablement inutile de rappeler
It's useful to
lorsque tout le monde
remind
comprend maintenant le contexte
people who don't understand the
que
context
ne devait pas et ne sera pas accordée à des gens
that
qui
this
ont
benefit will not
enfreint les
be given to
directives
people who did not follow public health directives and decided to travel. This benefit will not be offered to them. It's clear. I'd like to remind everyone that this benefit will be changed so that people do not receive this benefit, and it will be done appropriately, legislatively, and that is why my colleague, Minister Qualtrough, and other ministers are already working on this within the Canadian government and with other parties in a minority setting so that we can make the necessary changes. But Prime Minister Trudeau reminded everyone just a few days ago that these travelers will not receive the recovery sickness benefit when they have traveled.
Hi, Mackenzie Gray with CTV News. My first question is for Major General Fortin, and if Minister Anand, you want to chime in, I'd like to hear what you have to say as well. A number of provinces are saying that they're going to run out of vaccines soon. Major General, you've said today, too, that the provinces can expect, or you expect that the provinces will be able to significantly ramp up their ability to give out vaccines. So do you agree with the assessment of Premier Ford that Ontario, for example, is going to be running out of vaccines soon?
Thank you. I think
I'll start. If
Go
that's
ahead.
okay, Danny, and then I'll turn it over to you. I want
Go
to
ahead,
start,
Minister.
Mackenzie, by saying that we are all pushing in the same direction. We are all cognizant of the fact that this is the largest mass vaccination program in Canadian history, and that I'd like to say that the province's work to date, especially over the past week, has been impressive as they work to increase their own capacity to administer vaccines. It's important to remember also, from a federal procurement perspective, that we have been clear with our delivery schedules We have been clear that we will be ramping up with the doses that we are delivering to the provinces. In fact, we will be doubling the vaccine deliveries from January to February alone. This is information that the provinces have and that they can use for their planning purposes. So the phrase running out of vaccines has to be taken into that, in that context. That is, that the schedule is in existence, it has been shared with the public and the provinces, and the planning should take place on the basis of that schedule. And now I'll turn it over to Danny Fortin.
Thank you, Minister. The only thing I would add is that we're working very closely with provinces and territories, of course, and we're providing as much visibility as possible. Our numbers are their numbers. They have visibility on what's coming in January, both January and February, and can plan accordingly.
So it seems like we won't be running out. It's just that we'll have more capacity to be able to do dole out vaccines compared to the number of vaccines that we'll have. That seems to be the point that you're making. But I'll ask my follow-up question for Minister Anand. Israel has, I think, 1.6 million doses of the vaccine, and that's in large part because they paid a premium price for it. They've come out and said that they've paid $30 a dose. The Americans have come out and said that they paid $19 a dose for Pfizer. Is the reason that Canada doesn't have nearly the same number of vaccines as Israel, a smaller country than us, who signed a deal much later than Pfizer with us, is because we were not willing to pay the premium price that Israel paid?
Thank you, Mackenzie, again for that question. I want to start by saying that we put everything on the table with the vaccine companies in our negotiations with them. And so the short answer to your question is we did put price on the table, of course, as well as a number of other factors. And it is as a result of our very strong position at the negotiating table that we were able to sign with Pfizer and Moderna first, that we were at the front of the line for Pfizer and Moderna, that the chair of Moderna came out and said we are at the front of the line for Moderna. And in my conversations with these companies every day, that point is clear, that Canada is a jurisdiction that they are serving and servicing, and we will continue to work with those suppliers to accelerate deliveries earlier and earlier in 2021. That is the work that I am doing and the work that my department is doing every single day.
Tonda? Hi, I just want to come back to the idea that the provinces say, at least 4 of them have come out and publicly blamed the federal government for their fluctuating and unclear numbers and the inability to plan properly and to get the doses out. So what is the problem? Is it that the provinces are overbooking vaccinations and that they don't have vaccine for, that you've told them what their numbers are and you've delivered? Have you ever not delivered the doses you said you would deliver them? What's the problem?
I will start and then hand it over to Major General Fortin. We have been very clear with the provinces and territories about the numbers of vaccines that we are procuring and that are arriving in this country. We continue to share those tables with them in a very collaborative way, and we will continue to do that because we need to work collaboratively to ensure that Canadians are vaccinated. I will now turn it over to General Fortin because he is on the front lines with the provinces and territories every day.
Thank you, Minister. Thanks for the question. I think back in mid-December and December, we certainly had a number of uncertainties, and there's a number of factors at play here. But there were a number of uncertainties, and when vaccines become regulatory approved, and we have more fidelity on the stocks available by the manufacturers, we're able to build a solid plan. we've been working with a number of assumptions and sharing planning data in full trust and confidence with provinces and territories. But we're now in a position to share a lot more. As you got from my statement, we have visibility on January and February, like solid numbers to work with, which will be tremendously helpful now to provinces and territories. So they have a lot more line of sight, predictability. More equipment is also being distributed at a pretty steady pace to ensure that we have an ability to administer down to the, or to move down to the last mile and administer by provinces and territories.
If I may add a very brief additional remark. As the Prime Minister said this morning, this is the largest and most complex immunization campaign ever seen in this particular country. So there is, and there is still going to be some unknown and some uncertainty. But as the Prime Minister repeated again, this is a whole of Canada campaign. We are going to increase even more our collaborative capacity with provinces and territories to make sure that this is the success that Canadians expect and Canadians will obtain.
Okay, we'll go to the phone for one more question and come back to the room. Oh, sorry, my mistake, Tonda, go ahead.
Thanks. So maybe you could help me understand, and I still don't have an answer to the fact that why then are places like the University Health Network saying that they've run out and they've got 3 more days of appointments booked for people to get vaccinated, but they don't have vaccine. What's happening there? Are the provinces or those facilities overbooking when they don't have vaccine in hand? Is that what's going on?
Major General Fortin?
Yes, thank you. Well, I can't comment about Ontario's immunization plan or University Health Network bookings and plan. But what I can tell you is this: we provide as much clarity, as much visibility as possible on the doses available as we firm up those numbers with the manufacturers. And it's a collective effort, and we're very much in daily conversations with provinces and territories. The ramp up can be difficult because there's a desire to immunize at scale. The vaccines are coming. We've said all along 6 million doses between when we started in December to end March, and we're providing as much clarity as possible so that planners can plan as effectively as possible and immunize as rapidly as possible all Canadians who want the vaccine.
Okay, and now we'll go to the phone for one last question, then back to the room for one last. Thanks.
Thank you. Our next question is from Jaela Bernstein from CBC News. Please go ahead. À vous la parole.
Hi, I believe this question is for Dr. Sharma. Quebec Public Health is saying that the first dose of the Pfizer vaccine is actually around 92% effective just after the first dose, based on its interpretation of the data, though it has acknowledged it doesn't know how long that protection will last. But I haven't seen that 92% number anywhere else. And in fact, I've seen the FDA cautioning against interpreting the numbers that way. I'm just wondering how public health is interpreting the effectiveness of the first dose.
Thanks. It is Supriya Sharma. Thank you for that question. So in terms of the effectiveness of the vaccine before the second dose, I think the first thing to really make sure that we stress is that this is both the Pfizer and the Moderna vaccines are 2-dose vaccines. So in terms of getting to that peak effectiveness levels, you do need the second dose. And depending on which vaccine, it's either after 3 weeks or after 4 weeks, and it's either measured 1 week after that second dose or 2 weeks after that second dose. The difference in the numbers in terms of what the effectiveness of that interim period is, so between the first and second dose, depends on when you're making those calculations. So again, this is a little bit of detail, but with Pfizer, we've said that before the second dose, so after the first dose, it's got a 52% efficacy, whereas some people have done the calculations and have read either that same data set as 89% or 92%. And the difference in terms of those numbers is because some people, when they do the calculations, take out the first 2 weeks after you get the first dose. So basically they're saying, wait, that's not fair to be doing an assessment of the effectiveness of the vaccine for that whole time period because we know it's not instantaneously effective. We're going to take out, depending on the way that they've done it, the first 10 days, the first 12 days, the first 14 days. So you'll see different levels of effectiveness based on how those numbers are assessed. It's really important to note that the studies were not designed to look for that sort of information. So this is a bit of a back of the envelope calculation on that. The other part of it that I wanted to just raise is that I think a lot of people are interpreting the efficacy, the effectiveness of the vaccine as sort of, if somebody gets the vaccine, you can take a blood test and you say you're at 95% or you're at 89% or you're at 52%. That's not really the case. The effectiveness of the vaccines are measured based on how many cases you see in the group that did not get the vaccine versus how many cases you saw in the group that did. So if you're talking about a 3-week period for Pfizer between the doses or a 4-week period between the doses in Moderna, if you take out those 2 weeks in the front end, you're really only looking at 1 week for one vaccine and 2 weeks for another vaccine. And so that's a very short period of time to be looking for cases. So the last piece is that when we look at those other calculations, so the 92% or the 89% effectiveness for those vaccines before those doses, it really is kind of based on, as we said, those calculations, and we don't know what that really means. Does it mean that that likelihood of not getting the disease continues for a long period of time, or is it something that's short-lived? So, I think both the assessments are appropriate. There's different ways of looking at the data, but the bottom line is these are 2-dose vaccines. You should get the second dose. The second dose should be as close to the approved schedule as we can. And the way that we know about the 95% or the 94% effectiveness is really based on getting that second dose, and we're still monitoring to see how long that effectiveness lasts.
Follow up?
Minister Anand,
yes,
would you like to add some precisions?
A
follow-up question.
Jean-Yves. I just like to add something to Dr. Sharma's remarks. From a procurement perspective, the issue of the second dose has arisen in our conversations with both Pfizer and Moderna. And it is very important to remember that the recommendation from the manufacturer based on the clinical trials, and I assume their conversations with Health Canada, is that the second dose should be administered as instructed and should not be unnecessarily delayed. It's important from a procurement perspective to remember also that as we press for additional deliveries on an accelerated basis, we need to be able to show to the vaccine companies that Canada is indeed following the instructions that a second dose be administered in a certain time frame. So there's not only a health consideration, one ably expressed by Dr. Sharma just now, but there is also a procurement consideration that we need to take into account. Our arguments for accelerated deliveries are stronger if we can show the vaccine suppliers that indeed Canadian provinces and territories are following the instructions for the delivery and inoculation of the second dose that they have provided. Thank you.
Back to you on the phone.
Thanks. And a follow-up also for the minister. This is a question about disposable gloves. Our colleagues at Marketplace have been investigating the disposable glove industry in Malaysia. And they've been able to confirm that there are serious human rights violations, labor violations at some of the factories there. And experts are saying that there are strong indicators of forced labor. Millions of gloves from there are imported here to Canada, and some of the importers have federal contracts. And we know that these gloves are being used by hospitals here in Canada, by doctors and consumers as well. So the U.S. has recently banned the import of some of these PPE products, but Canada has yet to do so. So we're wondering why Canada isn't taking any action to stop these goods coming into the country.
Thank you so much for the question. As someone who has fought for human rights for my whole life, I take this situation very seriously. Forced labor is a significant and unacceptable problem in global supply chains. And as soon as I was made aware of this issue, I have ordered and asked my team to look into it and to discern what do our contracts say, what was the actual relationship. Our contracts for gloves in large part proceed through Canadian distributors or intermediaries. And so I've also asked my team to be in contact with those distributors. And we are working with our suppliers to investigate these allegations, to verify that their supply chains are indeed free from forced labor. As I said, it's an issue that I take personally very seriously and am working on it as we speak.
Okay, we're going to go to the room. Go ahead.
Hello, Mr. Anand. This is Maan Hamidi with the Canadian Press. I want to ask you again about the recent negotiations with Pfizer and Moderna. You said that you're always in contact with them, and you said the main focus is to ramp up the deliveries of the vaccine doses. Have you offered or paid more for vaccine doses recently to guarantee larger shipments of the vaccine?
Well, thank you so much for the question. And I just want to say that our negotiations proceed on the basis that everything is on the table. We leave no stone unturned. We have sorry, my video cut out there. We have to make sure that we convey to the vaccine suppliers that we will do whatever it takes to get vaccines into this country and to do so as early as possible. And so indeed, ensuring that we had vaccines into this country prior to Christmas did involve paying fair value for those vaccines. And again, we are all on the same page of the urgency of this situation. And we will stop at nothing to ensure that we get vaccines here as early as possible.
Thank you, Minister.
One thing I would add very shortly, in addition, in its support to what Minister Anand has said, is that we, as Canadians, we should always be both mindful and proud of the strong regulatory reputation that we have outside of Canada. The fact that our regulatory agency on vaccination is so strong and has such a good reputation also helps our ability to procure and to work with pharmaceutical companies. In addition, of course, the fact that we have a strong public health system, which reassures our partners outside of Canada.
Thank you, Ministers. My follow-up question is for Dr. Tam. You have said before that Canada tests about 5% of test swabs for genetic variants for the novel coronavirus. Do you think that's enough, given that what you've seen in other jurisdictions, especially in England, where things now almost are out of control?
We are doing genetic sequencing at a rate that's commensurate with a lot of countries and better than most. And we are rapidly increasing that capacity as well and providing that capacity to the province and territory so that your major provinces are able to do a lot of sequencing right now. And we are also then assisting with the smaller jurisdictions and smaller provinces as well. So as I said, we're sequencing about 5%, and but also increasing our laboratory testing strategies, looking at broader surveillance, but as well as targeting different populations, such as travelers, such as super spreading events, such as if incidence is increasing, for example, in a jurisdiction, we get those samples so that we can sequence them to see if there's any variants of concern. So, I think, yeah, so much higher than some of other countries, actually. And we are able, as you've seen, to detect the UK variant, and we're looking very closely for the other variants of concern as well.
Okay, that's the end of the press conference for today. Thanks, everyone.